Hey guys, Kyle here. Making this video just to give my testimony kind of for my hip pain and the surgery that I just underwent today. So yeah, let's get right into it. I'm gonna go over a little why I got the surgery, what led me to make the decision. So it all started back in 8th grade with my hip problems. I think I tore my psoas, and that led to a bunch of instability going through my high school year. And senior year comes around. The summer before senior year, I sprained my MCL, and that was due to a collision, my foot meeting the ball and someone else's foot meeting the ball, and they were sliding. So it put a lot of impact on my hip, which also twisted my spine a little and left me with some instability in my back. And my guess was that's what was causing some of my hip flexor pain throughout the past 6 months. So after that MCL injury and what I think to be a psoas injury, I started playing soccer again, and I went through a lot of physical therapy to get there. I did a lot of dry needling, just motion techniques and whatnot, but that would only help temporarily. I could never get what I felt was back to 100%. I would still have like a flare up in my hip flexors when I would run. That was more like higher up, and it would occasionally radiate down, but it didn't radiate down as much until like the couple weeks into playing soccer full go again. So I decided to make the decision of getting this arthroscopic hip surgery, and that was done today. It's currently May 8th, 2020, and what they did was they made a couple incisions on my right leg. I can't see it right now because I have an ice machine on, and I don't want to take off the dressing or the wrapping. And they made the 3 incisions, and then I think they went in with like a camera to fix the labrum, and then they went in with some tools. And this, I've seen some pictures and videos of other people taking pictures of their scars and whatnot. It didn't really look too serious. But I had 2 tears in my labrum on the right side, and I got FAI, hip impingement, which was fixed. And I also had some arthritis in the right hip, probably due to overuse throughout time and the instability I had. So yeah, now I'm post-operation right now, sitting in bed, sitting in my parents' room, and I'm doing everything I can to make things easier for myself. I have physical therapy on Monday, and what I'm doing is I'm doing just whatever I can to get around the house, get some movement. There's a machine called a CPM that I started with, and that's this thing right here. So what it does is you put your foot and your basically your whole right leg on it, and then there's a remote right there, and you press the button. So I'm going 30 degrees in extension and then 70 degrees in flexion with my hip. Just try to get some mobility and movement in the hip. That's a big thing, and I think it reduces the chance of blood clots and whatnot. I'm not a medical doctor, and I don't know if you should necessarily listen to everything I'm saying about the medical part of it, but I think my experience is something definitely to note. Because personally, I felt like my experience was different from everyone else's. Like, my pain was higher up in the hip flexor. It was like a burn, ache, and it wouldn't be right away. It would be throughout time. So, where was I? So, the CPM machine, yeah, we got that dropped off yesterday. And we also went to go buy an ice machine, which is down there, somewhere down there. And I use that whenever I'm done with the CPM, just because I like to, it feels good when I like warm up the hip and then put the ice on the right hip, because your hip gets tired in a way after the CPM machine, because it's like very slow, constant movement on the sore hip. But I have 2 days until I can shower, which don't really care. I got a nice buzz cut in preparation. Yeah, so not too bad. I got a bunch of medicine to go through. Some like hydrocodone. I don't really know anything. That's the only one I remember. But yeah, I'll probably, if I post this, I'll definitely be answering questions and whatnot in the comments, because I feel like this is something, if someone ever wants to talk to me about, I can definitely share 100% what I went through. If there's something you don't think I covered in here and whatnot, I mean, I am an athlete. I do play soccer, so maybe I can give you some insight into what it was like for me and my personal experiences with the preparation for surgery, my decisions, and basically the whole process over the past 4 years that led me to make this decision. Yeah, so that's all I got today. I got my little setup. I got this bed. I got a little remote. My parents' bed. Sleeping on mommy's side tonight. And I can move the head up, which makes it easier to get up out of bed. I try to move around as much as possible again to keep movement in the hips so it doesn't just get stuck. And I'm also doing like gas pedals with my foot. Again, for blood clots. Yeah, I got my Xbox set up. Watching some Conor McGregor documentaries. Probably gonna read some of David Goggins' book later. And yeah. So that's all I got. Post-op surgery. Same day. And I'll probably do this week by week with updates on things I've been doing. Pain levels. My activity. Yeah, that's all I got. So, thanks for watching. See you guys in about a week.